Come in.
Hi, my name's Ann. I'm a Texas State Nurse Practitioner student. I'm following Dr. Porter today.
Okay.
Can I first have you tell me your name and date of birth?
My name is Nancy Smith, and my birth date is 7/27/56.
Okay. And Miss Smith, is that okay if I call you that?
Yes.
Okay, what brings you in today?
I have been having a cough that's been lasting for a couple weeks, and it just won't go away.
Okay. Anything that you think brought this cough on?
Yes, I had a cold, and that cleared up.
Okay.
But the rattle in my chest is still there.
Okay. Any recent travel?
Yes. Actually, about a month ago, I went back to Nebraska.
Okay.
And we drove. It's a 12 to 13-hour trip, and we drive at night. And so the sleeping's not good, and having that air conditioning blow on you.
Okay. Any other complaints? Runny nose, sore throat, any ear pain?
No, that all went away.
Okay. Shortness of breath or any chest pain?
No.
Okay. And what seems to make the cough worse?
When I lay down, go to bed, it tickles to the point where I have to get up and take some cough medicine.
Okay. And how are you taking that every night?
Yes.
Okay.
Actually, I've been taking that every night for the last 3-4 days.
And what have you been taking?
NyQuil.
Okay. And it seems to be working?
Yes.
Okay. And no chest pain, no palpitations, right? No family history of lung issues, asthma,
No.
Bronchitis, pneumonia, anything like that before? Okay. Any other complaints today that brought you in?
My legs swell.
Okay. And is that an ongoing issue you've had?
No, that's just been starting to.
Okay. And when do you notice that getting worse? Is it when you wake up in the morning?
No, actually when I'm outside with this heat, it tends to swell. And
Okay.
then if I eat lots of salt before I go to bed.
Okay. And if you don't eat salt, do they tend to stay more normal
Yes.
in size?
A
And
little
then
better.
when you come back inside from that heat? Okay. And with your recent travel, no history of blood clots before?
No.
There's no pain to palpation or anything like that? No color changes that you've noticed? And then no circulation issues, right?
Right.
In your past. Okay. So I know you eat salty foods. Do you exercise?
Yes.
Do you have any hobbies?
I exercise. I read.
Okay.
And I play games
Okay.
on my iPad, on my phone.
And how often during the week would you say you exercise? How many minutes?
Oh, I've been actually these last 3 weeks an hour and a half a day.
Good. And your cough doesn't seem to flare up when you're working out or anything like that?
No, I'll just cough. I'll feel the mucus moving, and I'll cough once. And
Okay. It usually clears up from there. Okay. Do you work?
yes, I'm a respiratory therapist. So I work at a rehab hospital, part-time.
Good. And do you live by yourself?
Yes,
And do you feel safe there?
yes,
Good. Do you practice safe habits? I'm sure you do sprinkler systems in the ceiling and
yes,
smoke detectors. And then do you wear your seatbelt when you drive?
yes.
Good. Do you smoke or drink?
Social drinker. Maybe a couple drinks a month.
Okay.
Like
And
that.
no illegal drugs?
No.
Okay. Any surgeries before?
Yes, I've had just 2 C-sections. I've had my tubes tied, bone spurs on my little toes removed.
And no complications with any of
No.
that? And then any blood transfusions before?
No.
Okay. As far as your past medical history, what kind of problems do you have?
I've had colonoscopy done back in 2013. I get a yearly physical, have my mammograms. I had Bell's palsy back in 1993.
No
Other than that,
reoccurring issue with that? No
No.
long-lasting effects? Okay. And then as far as your colonoscopy and mammogram, everything turned out okay?
yes,
Good. Do you have any high blood pressure, diabetes?
yes, I have high blood pressure.
Okay.
So my cardiologist started me on high blood pressure medicine in June, and I'm trying to reduce the amount of red meat that I eat to try and get my cholesterol down. But I am taking lisinopril for my blood pressure, along with the Lasix pill and Livalo for my cholesterol.
Okay, and the lisinopril, no cough when you started it or anything like that? No problems when you took it? Okay. And the Lasix, when you take the medication, does it tend to help the swelling that you have?
Yes.
No more weight gain than normal from the water weight? Any gain in 10 pounds in a week?
No.
Okay. No feeling like it's in your lungs when you, shortness of breath when you walk or anything like that?
No.
Okay. Have you reached menopause yet?
Yes.
Okay, and when did you reach that?
Probably when I was 52.
Okay. Are you having any abnormal bleeding or discharge or anything? Any problems going through that? Okay, good. As far as your immunizations, TB, tetanus?
TB's up to date because of work. Tetanus, I had a fainting spell and hit my head. Landed up in the emergency room. They gave me a new tetanus shot. Probably back in, that was probably in 13 too. Hep B, got that vaccination. Went to Honduras and got all those vaccinations. So
Okay.
I'm fine.
Have you had your flu shot this year?
Not yet. This year, last year I didn't.
Okay, just make sure you get it this year, especially because of your age. I know pneumonia, they usually request at 65, so you've got a little bit of time.
Okay.
But you may want to look at the shingles. Definitely stress can bring that on, so we definitely don't want you to develop any of that kind of pain.
Yes.
As far as family history goes, mom and dad
are both dead. Mom's been gone about 14 years. Dad's been gone probably about 24 years. Dad died of Alzheimer's. Mom died of, I want to say old age, but she was starting to get sick. So.
Okay. And as far as your brothers and sisters?
There's 10 of us, 5 brothers and 4 sisters, so there's 5 and 5. We all have high blood pressure. We all have high cholesterol, and my brothers have had the heart attacks. Well, not heart attacks, but they've had heart attacks and they've had stents.
Okay.
And then I've had 2 nieces with strokes and a nephew that had a heart attack.
Okay.
So he's got stents in. But we're all still alive.
Good. Well, definitely keep up with your exercise and definitely keep up with those cardiology appointments.
Okay.
So they can make sure you catch all that before anything serious happens. Have you had a colonoscopy or a mammogram?
Yes.
And everything was
That's
okay
fine.
with that?
Mm-hmm.
We touched on that, didn't we?
Right.
Good. Cholesterol, are you getting that checked yearly? I know with your physical. Good. Any allergies to medications?
No.
Okay. Do you have a living will?
Yes.
Good. And you've got a power of attorney in place and all your wishes?
Mm-hmm.
Good. Okay. So medications, I know you said you take the lisinopril and the Livalo and the Lasix. Do you take anything over the counter besides the NyQuil?
Advil for pain or headaches, and then I take vitamins.
Okay. And how often would you say you take the Advil?
Once a month, maybe.
Okay. Any problems? I know we're going to go head to toe now. We're just going to review your systems. I know you said no sore throat or nasal drainage, nothing in your ears, no blurry vision.
Right.
Do you wear contacts or glasses?
Yes.
Do you get yearly eye exams?
Yes.
Good. And your blood pressure's been okay, that it hasn't been too high where it's caused any problems?
No, since I've been on the medicine.
Okay, good. No head injuries or traumas before? Okay. Anything in your neck? Anything more swollen than normal? No problems there? Okay. Your teeth look good. Do you see the dentist regularly?
Yes.
Good. Definitely keep up with that. No broken teeth or anything like that
No.
causing you problems? Good. As far as your arms, no tingling or numbness going on? No breast problems, lumps, or anything that you've noticed?
No.
Okay. No discharge? Okay. As far as your stomach, any abdominal pain?
No.
Any change in bowel problems?
But I am starting, along with my cholesterol, changing eating habits. I'm trying to do gluten-free.
Good. Okay. No blood in your stool or anything like that. Okay. As far as urinary, any urinary frequency, blood in your urine, discharge there? No. Okay, good. As far as no pelvic pain, anything like no kidney pain? As far as your legs, I know we touched on the swelling, and there's no pain there, and you said no color problems. Your gait, been good. Okay.